Thanks. All right, well, I am Stephanie Adams Boehm.
Yeah, I was
got
going to
married 6 years ago.
Yeah. FYI there, Josh.
6 years ago.
I was there.
We had our wedding, but a lot of people still know me as Adams since my parents are so popular. So this is me about 10 years ago when I was in nursing school. I like to say that I stopped aging when I started taking Neolife 17 years ago when I was in high school. So I look pretty much the same as when I was 17 when I started taking it. And I just wanted to give a good shout out to the Clarks and to Brendan and to everyone who put so much hard work into putting on this great retreat for us, providing us with so much great education and knowledge, and for my parents who have been researching nutrition for about 40 years and just never gave up, just kept pressing until they found something that really worked and helped my mom feel so much better. So today I'm going to be talking about nutrient depletion during pregnancy and breastfeeding and how to prevent that. And I've been working in labor and delivery as a nurse for about 3 years now, and before that I was a ER nurse for 4.5 years. So here we go. This is my amazing husband Christian. Unfortunately, he couldn't be here with us this weekend. He just started a new job. He has been trained as a healthcare chaplain, so he has a real heart for ministry, and really wished he could be here. He didn't have any time off with this new job, so you'll get to meet him another time. This is when we did the Spartan race a couple years ago, and it was amazing, but I'm just going to tell you a little bit about my Neolife story real quick. As you just heard my mom talk about all of her health challenges, she really was a much different person when I was a teenager, very grumpy, had a lot of headaches, a lot of pain all the time. Whenever she'd wake up, me and my brothers would just run away. She's awake. And so she is a completely different person. Everyone now is like, oh my word, your mom has so much energy now. I can't believe it. And I just feel like my parents not only stopped aging, but in the past 17 years just are getting younger and younger. Pretty much just like Benjamin Button or something. So, but I just want to talk a little bit about my life with Neolife. Thankfully, because my parents have been into nutrition for longer than I've been alive, I wasn't very sick as a child. I don't have any memory of ever taking an antibiotic, which I'm really thankful of. But when I was a teenager, I had a lot of problems with acne on my arms and my back. And after probably about 6 months with Neolife, some extra vitamin A, that all cleared up. In the past 17 years, while I've been on Neolife, I've not taken one sick day from work, which is really amazing, especially working in the emergency room while people coming in. I've never had the flu. And I mean, I have coworkers that are getting sick all of the time, and it's just amazing that I don't have to miss work for sickness. I've increased energy and endurance. I love the Neolife tea, especially when we're going on big road trips. Christian and I took a 21-day road trip around Western America on the way to the Seattle convention this summer, and I just love the tea, and it works better than any energy drink or coffee. I've improved focus, especially during nursing school. I had a hard time concentrating sometimes on my textbooks, and my parents would send me a bottle of Trey and a small bottle of aloe every finals week, and I would just chug that, and I would focus really well, so that helped a lot, and I appreciated that. I have faster recovery. If I do get a cold, it usually only lasts for 2 or 3 days, and it's much more mild instead of kind of lingering on for several weeks like it used to when I was younger. And kind of a newer term is hangry. I used to feel this a lot when I was a teenager, where it's like you get angry because you're hungry, and your blood sugar's dropping, you're getting hypoglycemic, and the protein shakes really help just keep my blood sugar level and keep me from feeling hangry. So, all right, so this is life with a child. Everyone, hey, you look tired. Are you getting enough sleep? Me, well, when I sneeze, my eyes close. So you might feel a little bit like that if you're a new mom, especially if you're not on Neolife. And I'm going to talk a little bit about postnatal depletion. And what does that mean? It's kind of a newer term that they're starting to come out with more information on. Gwyneth Paltrow is kind of like heading this up, so you might see her talking about it. But it's when I talk about it, you'll probably know, like, be able to think about a lot of moms that kind of go along with these symptoms. They're complaining of baby brain, like brain fog, poor memory, they start forgetting stuff, poor concentration, they're just exhausted all the time. They might have some anxiety, and all of this postnatal depletion can contribute to postpartum depression, and it really starts during pregnancy. So as moms have babies, the babies are, kind of like parasites. They're going to suck out anything that they need from the mom. So if the mom is not replenishing those nutrients, then she's just going to end up being more and more depleted and exhausted and anxious, and like my mom talked about, memory health and brain health. All of these nutrients go to the brain. So a lot of them, a lot of these problems show up with mental health, and postpartum depression is such an epidemic in our culture right now. And so, especially if people have babies back to back, they have one baby and then like shortly later, short time later, they have another one, and they're not replenishing all these nutrients, the mom is just going to end up feeling more and more depleted overall. And so, since this starts during pregnancy, what can we do to help prevent this from happening and help her feel great throughout pregnancy and being a new mom? So these are just some great moms that are full of energy. Apparently, neolife moms like to have a lot of kids, I guess. But I just look around and see so many, vibrant, energetic moms here, even if they have, 10, 11 kids. And here's my mom. She didn't used to be energetic, but she is now. And I know Marjorie Clark has, shared her story about how much better she feels on the products. So I really believe that the solution to preventing and helping recover from postnatal depletion is focusing on your gut health, plenty of omega-3s to reduce inflammation, and not being afraid to ask for help. If you are like my mom, sitting on the kitchen floor crying, you really need to ask for help, and don't be ashamed. And if you feel like you're starting to get really sad and you're crying all the time, that's really the time not to be embarrassed and to seclude, deeper into your, under your covers, but to reach out and say, I'm really struggling, I need some help with this. And then getting sleep. A lot of other countries, they look at the postpartum period much different than America. We're just like, oh, you're in the hospital for 2 days, you go home, and then you want to get out and do stuff as soon as possible. And a lot of moms are not resting and letting their bodies heal up after delivery like they should. Some people in China especially, they look at the postpartum period, like the month after delivery, as the time for the mom to recover. And people bring her meals, and they watch the other kids for them, and they just let her really sleep in recovery and bond with that new baby. And here we're just like, go, 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 get back to work. But you really do need that time to sleep and to recover, and replenish your body with the nutrients that have been taken, out of you to give to the baby, especially if you're still breastfeeding. And so anything that you can do, if you know a new mom, just go over to her house. Don't give her the option. Just say, coming over, so you can take a shower, you can go shopping, or you can take a nap. We really need to look for ways to support the new moms in our community. And exercise and community are huge. I don't have kids yet, but I have so many friends that do, and just them, being able to hang out with other new moms and talk with them is really great for their mental health and just helping be an encouragement for them. And then a healthy, balanced diet and supplements to fill in the gaps, which I'm about to talk about. So, as they were, Josh just talked about Wisdom Builders and Alan. If you haven't looked at it, it's a really great resource, and this is just a little example. They have the proven product programs, and they have good, better, and best. And so the good products will just have like a couple, and then if you have a little bit more money, you can get the better, and then these are the best. So they have so many great resources on there. And then for pregnancy and nursing, the ones with the stars by them are the ones I'm going to focus on today. The Pro Vitality Plus, the Neolife Shake, omega-3 salmon oil, and chelated CalMag, and then a couple other things as well. But just take a look at those because these are on there for our resources, and they're, because people have used them and they've really worked to help keep them healthy during these times. So this is one of the main topics. I want everyone to pay attention. I'm not going to talk about anything weird or gross or anything. So, but this is super, super important. I don't think a lot of people realize that modern science has revealed it takes nearly 100 days for a woman's egg to mature before it's ovulated, and 72 days for a man's sperm to form. And this suggests that at the very least, a 3-month period of optimal nutrition for a couple will produce the healthiest possible egg and sperm. And so this is not just talking about the moms, but for the dads too. And how many people do you know that say, like, oh, I'm thinking about getting pregnant, like, both the mom and the dad are taking good nutrition, like, nope, like hardly anybody says that. They just say, oh yay, I'm pregnant, now it's time to start taking a prenatal vitamin. So they run out to CVS and grab something. But so much development has already happened before a woman even knows that she's pregnant. So this is the recommendations from ACOG. It's the American Congress of Obstetricians and Gynecologists, and that's what our OBGYNs follow. And so they recommend that you get folic acid, iron, vitamin D, calcium, and omega-3s. I know it's hard to remember all of these numbers, but just remember that women that are pregnant and breastfeeding, they need additional nutrients than just the basics. The Pro Vitality and then Shake are a great place to start, but they do need some additional things, and so those are what we're going to talk about now. Okay, so folic acid is a type of B vitamin. It's what John Miller was talking about yesterday, and it helps prevent neural tube defects, which is, one is spina bifida and one is anencephaly. And so the picture of the baby here, you see like a little bubble on his back. That is spina bifida, and it's when part of the spinal cord is formed kind of in a bubble outside of the baby's back. And so that can be really, terrible. It can cause permanent paralysis of their legs. And anencephaly is another one where most of the skull and brain do not develop, and those babies cannot survive. And this usually happens within the first month of pregnancy. There's so much that's forming in the baby in the first couple of weeks. And so if you're not taking B vitamins and folic acid before you're pregnant, you have a much higher risk of this happening to the baby. And getting enough folic acid before and during pregnancy can prevent 50 to 70% of these. So that's huge. I mean, B vitamins are not an expensive thing to take. And if anyone's thinking about getting pregnant, they need to already be taking these a couple of months beforehand. All right, so another really important one is iron. The normal hemoglobin level in women is 12 to 14. And so hemoglobin is, I like to describe it kind of like an Uber driver. So hemoglobin is part of the red blood cell that carries oxygen. And so if you're like, oh, I need a ride, I'm going to call an Uber driver. And you call, and they don't come, and they don't come. It's like that when you don't have enough hemoglobin, because you're like, I need the hemoglobin to carry the oxygen around my body and drop it off everywhere. And so if you don't have enough iron, you can become anemic, and your hemoglobin level will drop, and you can start feeling weak and dizzy because you're not getting all the oxygen around your body like it should be. You have a 20 to 30% increase in red blood cells when you're pregnant, And so taking additional iron is really crucial. I see so many women that are anemic during pregnancy, and it just helps them feel weak and tired. And taking iron that, normal iron from like a drugstore, it makes so many women feel sick and constipated, and they're just nauseous. And so a lot of times, my patients come in and I'm like, oh, are you taking a prenatal vitamin every day? And they're like, well, I was, but it made me sick, so I just stopped taking it. And a lot of that, I think, has to do with the type of iron and the way that Neolife has made our iron. If you know a pregnant woman and she's having a harder time digesting it, the chelated iron in the multivitamin and the vegetarian multi are really, really great and much easier on the digestion. So you can recommend those to them. And then anemia during the first 2 trimesters increases the risk of preterm delivery or a low birth weight baby. And it's also important to take extra vitamin C because that helps increase the absorption of the iron in the body. And some good sources of iron are dark green leafy vegetables, red meat, and eggs. All right, so this is me and my mom at the Neolife Women of Wisdom Special Women's Convention in 2008. And we're holding the CalMag right there. And it's important to take extra calcium and magnesium and vitamin D while you're pregnant. So this is a really great thing to add to your Pro Vitality Pack. And if they can take 6 CalMags every day, that would be really great. As you're, especially younger women, up until when you're about 30 years old, you're still building bone mass. And then after that, it just keeps, you're not building it anymore. So you're either going to maintain it or you're going to lose it. And so it's very important, especially for women, to be taking calcium because they're at a higher risk for osteoporosis and less bone mass and fractures when they're older. And so as the baby is forming, if you're not taking calcium, they're just also going to kind of suck that out of your bones. And so that's why calcium in pregnancy is super important. Magnesium, this is one of our newer products, and I really love it. And there's a lot of research being done now about magnesium during pregnancy. And so if a woman comes in with preeclampsia, which is really high blood pressure during pregnancy, the treatment for that is that we give them IV magnesium. And so I was thinking, like, why aren't all women taking magnesium? If this is a treatment for, preventing, lowering their blood pressure and preventing seizures, if their blood pressure gets too high, why aren't they taking it all along? And you really do need more magnesium during pregnancy because the way that your body works during pregnancy is that renal excretion increases by about 20% during pregnancy. And so that renal is your kidneys, and so it means that your body is just excreting things in a different way during pregnancy. And so you're getting rid of more magnesium, so you need to take more to replenish that. Magnesium deficiency during pregnancy is associated with preeclampsia, that's the high blood pressure, preterm birth, gestational diabetes, low birth weight babies, leg cramps, and it might also increase your risk for miscarriage if you're low in magnesium. So magnesium is one of our cheapest supplements, and 300 to 400 milligrams a day is not that much. It's like taking 2 of our magnesiums. So taking that before you get pregnant, during pregnancy and breastfeeding can have a lot of really great benefits. Another really good one is vitamin D. Now a lot of OBGYN offices, ours included, are starting to test women's vitamin D levels because it's been shown that if your vitamin D level is low, it really increases your risk for having preterm delivery. Vitamin D supports breast, bone, heart, and immune health. And you think like, oh, well, if I go out in the sun, like I'll be fine, like that's how you make vitamin D. But we're testing every pregnant woman's vitamin D, and I look at it on their labs, and I have never seen anyone whose level is even 30 if they're not taking a supplement. It's like everyone is deficient. They're like 19, 10, it really should be over 50. And that's the optimal level, is that it should be over 50, and it's really rare that I see anyone who's even over 30.
50 what? Milligrams?
I'll put it on here. It's 50, the optimal level is 50 to 100, and it's ng per milliliter.
Milligrams.
Yeah, but it just says, if you just remember that it should be over 50, it's a blood test. And low vitamin D increases your risk for cancer, asthma, type 2 diabetes, high blood pressure, depression, Alzheimer's, autoimmune diseases, and these are some of the reasons why we might be deficient. The amount of vitamin D you get from exposing your bare skin to the sun, it depends on the time of day. If it's closer to noon, when the sun is high, you're going to get more vitamin D. Where you live, if you live closer to the equator, you'll make more. The color of your skin, the lighter your skin, the easier it is for you to make vitamin D. The amount of skin that you expose. And sunscreen prevents your body from making vitamin D. So a lot of people are like, oh, we gotta put on sunscreen before we go outside. But really, if you can go outside for 15-20 minutes before you put on the sunscreen, that will be much more beneficial because you'll be able to make that vitamin D. And vitamin D also increases your calcium absorption. So just remember, anyone can go to your doctor, or you can go to a lab test center and ask to get your vitamin D levels checked. But your goal is to have it above 50. So another really big thing is that when people are pregnant, people are like, oh, you're eating for 2, you can eat whatever you want, like, just eat one for you and one for the baby, you'll be fine. But really, like, you don't need that many extra calories during pregnancy. You really, in the second and third trimesters, you really only need about 300 extra calories, which is like a snack, pretty much. One extra healthy snack per day. And during breastfeeding, you really only need about 500 additional calories a day. So it's very important to remember that you're not like eating for 2. You want to think, I'm eating the protein for 2, but not calories. Because, I mean, so many women are like, well, I can't get the weight off from this pregnancy. I gained, 50, 60 pounds. And you really should be gaining usually about 25 to 30 pounds. And if you're increasing your protein but not the amount of calories so much, then it's going to be much easier to maintain your weight and to be able to get that weight off after pregnancy. So that's one of the reasons why I really love our shake, because it's 18 grams of protein, only 140 calories, helps keep you full throughout the day, and you can increase your protein in a great way without getting tons more calories. Salmon oil, adequate levels of omega-3s during pregnancy and breastfeeding. They improve development of the fetal and infant brain, cognitive development, visual acuity, hand-eye coordination, attention span, and IQ. So if you want a smart baby, you probably should be taking some salmon oil. And it decreases the risk of allergies and asthma in the baby, eczema, and ADHD. And I just see so many kids and babies with allergies and asthma and eczema and ADHD. I mean, it's just an epidemic. And so it's really important to be taking those throughout pregnancy to help protect the baby. And then also in the mom, it helps reduce the risk of preeclampsia, preterm labor, and 6 times less chance for postpartum depression. So that's humongous. And postpartum depression affects about 1 in 5 women now. So it seems like a lot, but I really think that a lot of people don't talk about it, and they feel embarrassed. And I have some really good friends that are like, oh, I was really happy that I had a baby, but I just feel sad all the time and I'm embarrassed about it, so they didn't want to talk about it. And I wouldn't say that it's 6 times less chance of postpartum depression with any salmon oil. I can only talk about Neolix because it's so great, and they test for so many toxins and make sure that there's no heavy metals or anything in there. So this is Buddy from Elf, one of my favorite Christmas movies. I love Morning Sickness. Nosh is my favorite. Said no one ever. So there are a couple things that you can do with nutrition to really help with morning sickness, because nobody wants that, and it affects so many women. So diclegis is a kind of a newer, more nausea medication that a lot of pregnant women take. And there are 2 ingredients in there, antihistamine and vitamin B6. And so the medical community is already recognizing that vitamin B6 helps with nausea during pregnancy. So I can't stand up here and tell you I recommend that you take diplegious, but I can recommend that you take vitamin B6. And then a lot of women are also deficient in zinc, magnesium, and copper, and those have also been linked to increasing morning sickness and nausea during pregnancy. And protein is a huge help, because I know some women that have taken the Neolife shake in the morning, instead of like grabbing a saltine cracker, they drink a shake, and they feel like it helps a lot more with the nausea, because hypoglycemia can increase nausea, which might be why you feel it more in the morning, because you haven't been eating all night. So instead of grabbing the saltines, just put a shake by your bed and drink that right in the morning, and hopefully you'll feel a lot better. So I just want to encourage everyone again to really use our resources that we've been given. Chad and Jenny's did a really great talk on the podcast last year, and they really encourage everyone to just keep it simple and start with the basics. So if anyone, if they're like, I don't have a lot of money, like really just encourage them to get on the breakfast pack. That's going to be so much better than like any of the prenatals out there, and especially if they're, better, able to digest it and they're not getting nauseous, then you're going to be more likely to take it throughout pregnancy, and it's going to be really great for them and for their baby. And Christian talked about this the other day, Neolife, which means new life, which symbolizes the power of giving your body the nutrients required to live a life full of health and vitality. And that's what we want for all of our moms and the babies. And this is my nephew Brennan, and he loves Neolife. He's always like, let me read a Neolife pack, and let me chew up a salmon oil capsule. And so he, yes. And so I just, I've seen so many women deliver babies, and I really notice a big difference in, seeing a woman who's healthy, who's been exercising in pregnancy and taking care of herself, and then someone who's overweight and hasn't been taking care of herself and not eating well. There's a big difference in how their recovery goes, how their delivery goes, even their pain levels after pregnancy. The women who are in shape and taking care of themselves are able to recover much quicker, have better, usually faster deliveries, a lot less pain afterwards. So if you have your little takeaway spot and you want to put this down, maintaining a healthy diet and filling in the gaps with whole food nutrition starting from at least 3 months preconception through after breastfeeding is crucial for mom and baby's optimal health. So just remember, if you know anyone that's thinking about getting pregnant, just encourage them to start taking the products now and not waiting until after they find out that they're pregnant, because so much of that really important development happens in that first month to 6 weeks before most women know that they're even pregnant. So, and this is us last year in Las Vegas at the Neolife convention, just showing all of our energy and vitality. And I just want to thank all of you for your attention, and you've been a great crowd.